Hi there and welcome to Anatomy Hack. Today I'll show you how to draw the carpal tunnel and label its boundaries and its contents. The way we'll do this is by first taking a quick look at the two rows of carpal bones that form the wrist. Then we'll take a look at each tunnel that is formed by the proximal and distal rows of carpal bones, which together make up the carpal tunnel. Lastly, I'll share with you some common treatments of carpal tunnel syndrome. So let's get started. So today is all about the wrist. Take a look at this surface anatomy image that has labels of all the different features on the hand. Today we'll only focus on this part of the wrist. So don't worry about all the upper names and labels. In particular, let's focus on the distal wrist crease. The carpal tunnel extends distally by about 3 centimeters past this crease. So it's from this view that we can get an appreciation of where the carpal tunnel sits relative to the rest of our hand. The proximal wrist crease marks the superior margin of the synovial sheath that covers the flexor tendons as they pass through the carpal tunnel. Now if you take a look at this picture, you can see how the carpal tunnel is pretty narrow and the space in it is fixed, as in it doesn't change. The carpal tunnel is formed by the carpal bones and the ligaments that attach them together, therefore it's described as a fibro-osseous tunnel. We can see here in this picture that it's where the flexor tendons and the median nerve travel through from the forearm and into the hand. So as always, let's consider where the word origin of carpal is from. The word carpal is derived from the Greek word carp, which means to pluck, and that's an action that the wrist commonly does, like when someone plays violin or when they play harp or guitar. So I hope understanding where the word carpal has come from helps you to remember what the carpal tunnel is. Okay, let's start by first revising the carpal bones. We know there are 8 carpal bones in total, and the way we remember them is by the mnemonic, "Some lovers try positions that they can't handle." So there are our 2 rows of carpal bones. We have the proximal row and the distal row, and each of those rows is associated with a tunnel. So there are essentially 2 tunnels that form the carpal tunnel. So let's go in and draw both the proximal tunnel and the distal tunnel. So both the proximal and the distal tunnels have a similar shape, and it's like a U shape that's formed by the bones, and then the top of the U shape is closed off by the flexor retinaculum or the transverse carpal ligament. It's the same structure, just with different names. So also making up the bottom part of this U, or the bony part of the carpal tunnel, we have the carpal bones and we have the carpal ligaments that join the carpal bones together. So this is why it's called a fibro-osseous tunnel. Okay, so now let's draw both the proximal and the distal tunnels. The only difference between these 2 tunnels is the carpal bones that make up the walls and the floor of the tunnel. Now the contents are the same, and the roof is made up by the flexor retinaculum for both of the tunnels. So starting with proximal, the proximal carpal bones are the scaphoid, lunate, triquetrum and pisiform. Scaphoid bone, next is lunate, then triquetrum and pisiform. Now these bones are all connected strongly together by these interosseous intercarpal ligaments in grey. And the roof of the carpal tunnel we're going to indicate with two lines. The reason we're having two lines is because the flexor retinaculum has two layers. Flexor retinaculum. It has two layers. It has a superficial layer and the deep layer. Now these two layers come apart here and leave this space, which is an important space where the tendon of flexor carpi radialis sits. I'm just going to draw that in orange straight away. Flexor carpi radialis. That's outside of the carpal tunnel. It is not considered a component of the tunnel. The components of the tunnel are as follows. Let's list them. Firstly, we have the tendons of flexor digitorum profundus, and they sit right down the bottom of the tunnel. They're the deepest structure. Next are the tendons of flexor digitorum superficialis, and they are arranged more in a square, like that. And both these flexor tendons are encased by the same sheath. And I'm going to draw in orange there. Encased by the same sheath. Alright, next let's draw in the median nerve. Median nerve there. And lastly, let's draw in another tendon. That's flexor pollicis longus tendon. Okay, so they're the contents of the carpal tunnel. We have the tendons of flexor digitorum profundus most deeply. Then we have the tendons of flexor digitorum superficialis, and they're encased in the same synovial sheath. Then we have the median nerve, and we have the tendon of flexor pollicis longus, and I'll just draw in the little sheath around flexor pollicis longus and a sheath around flexor carpi radialis. So now if we draw the carpal tunnel using the distal row of carpal bones, it would look something like this. The trapezium, right, that is TM. Next we have the trapezoid, right, that is TP. In the middle is capitate, the hamate bone. The roof is formed by the same structure, and that's the flexor retinaculum. And the contents are exactly the same. I won't redraw them because they're just the same. Now I'd just like to add in here that the position of the flexor tendons is quite consistent among individuals. So if we consider the flexor tendons of flexor digitorum profundus, these ones most deep there, the order that they run in goes 2, 3, 4, and 5, referring to which digit they're going to, that tendon's travelling to. If we consider the tendons of flexor digitorum superficialis, those 4 there, the position goes like 2, 3, 4, and 5. So that's the most common position for the tendons to be in, and they're numbered by which digit the tendon is travelling to. So I hope that the cause of carpal tunnel syndrome will now be a little bit clearer after drawing it, because I hope you can appreciate how the carpal tunnel is so space restrictive. So if we consider how carpal tunnel syndrome comes about, it's from the inflammation of structures within that tunnel, which leads to compression of the median nerve itself. So when we have compression of the median nerve, this occludes the small blood vessels that supply the nerve, which leads to edema or swelling, and eventually ischemia of the nerve tissue itself. So the signs and symptoms that we get from carpal tunnel syndrome are often nerve related, and they include things like pain in the hand and the wrist, or pins and needles and numbness, often across the median nerve dermatome. So here we see the median nerve dermatome, and this is where symptoms are commonly seen in carpal tunnel syndrome patients. So it might be pain or numbness in the palm and the lateral 3.5 digits. But other symptoms and signs include reduced grip strength, abductor pollicis brevis wasting. So here we can see wasting of the right hand side abductor pollicis brevis muscle, which makes up most of the thenar eminence here. And if you compare that to the left hand side, you can see just how much more muscle mass there is on the left hand. And this all comes about from denervation of the thenar muscles, which leads to atrophy. Now, symptoms of carpal tunnel syndrome usually become more severe with wrist flexion because the space in the carpal tunnel is reduced. So during typing or any other activity that requires wrist flexion, the symptoms often get worse. Now, what's interesting is that the symptoms are pretty quickly relieved by wrist extension, and you can imagine that that is allowing more space into that carpal tunnel that's relieving the compression on the median nerve. Most intermittent cases of carpal tunnel syndrome reside with conservative management, although chronic cases usually require surgical intervention, so cases that have lasted for more than 6 months or a year. And all this means is that a surgeon will cut the transverse carpal ligament, or the flexor retinaculum, as we saw in the drawing, which is the roof of the carpal tunnel. So by cutting the roof, it will allow the internal compression to be released and give the nerve more space to glide within the tunnel. So that's it, guys. That's how I draw the carpal tunnel. I hope you got something out of this video. Thanks for watching, and we'll see you in the next video.